Good afternoon, everybody. Thanks for taking your time and attending this session. So before starting the session, I just want to introduce about the session. Nova IVF Fertility is glad to present everything about fertility, a free webinar series for 5 days, which is hosted by leading IVF specialists in India to spread awareness about various aspects of infertility and the treatment options available. Today's session is about donor program in NIF, Nova Institute of Fertility. And the doctor who is going to present, I want to just introduce about the doctor, Dr. Saroja Koppala. Dr. Saroja Koppala has completed her MBBS from Kurnool Medical College, postgraduate from Sri Venkateshwara Medical College, DFFP UK, and MRCOG from Royal College of Obstetrics and Gynecology, United Kingdom, and British Fertility Society Accreditation, United Kingdom, in management of infertile couples, embryo transfer, and IVF. Doctor has a vast experience in the field of infertility, and she has worked in Great Western Hospital, Swindon, Diana Princess of West Wales Hospital, Dundee University Hospitals, Queen Mother Hospital, and in Southern Hospitals, Glasgow. She was trained at Aberdeen Fertility Centre, one of the best fertility centres in the world, under expert guidance of Professor Siladitya Bhattacharya and Professor Mark Hilton, ex-chair British Fertility Society. She is completely adept in managing all types of infertility problems and has many successful pregnancies in her life. She is an expert in management of women with recurrent implantation failures, low ovarian reserve, endometriosis, and recurrent miscarriages. She has publications at international levels and has attended many conferences across the globe. She is a member of Indian Medical Association, ISAR, Royal College of Obstetrics and Gynecology. I thank ma'am for conducting this session to us. Ma'am, we can start the session, ma'am.
Thank you, Kiran, for your introduction. Good evening, everyone, and welcome to the webinar series conducted by Nova IVF Fertility Center. So I'm Dr. Saroja Koppala, Senior Consultant at Nova Fertility Center, Kukatpally branch in Hyderabad. Today I'll talk to you about the donor program in IVF. Could you please change, please? Yeah. So infertility. So what is infertility? So when do we call it as infertility? When the couple start trying for a pregnancy, and if they have not conceived after 1 year of regular unprotected sexual intercourse, then we call it as infertility. So nearly 85% of the couple achieve their pregnancy within 1 year of trying. And however, 15% of them will not be able to achieve a pregnancy. And in a woman less than 35 years old, and if they're not able to conceive within 1 year of trying, then we have to evaluate, investigate, and start treatment. However, if the woman is more than 35 years of age, then it is ideal to start investigation after 6 months of trying. And if the woman is more than 40 years, then we have to start immediate evaluation. And infertility is a global health problem. Next slide, please. Next slide, please. So for us, the main aim is to have a healthy child, for which we need a healthy, beautiful embryo, for which we need a healthy egg and a healthy sperm. Next slide. So donation program is a very successful form of assisted conception unit. It helps couples it makes couples to have a child when one or both the partners are not able to provide their sperm or eggs or their embryos. And the main thing is people who are undergoing this program and people who are donating should have thorough counseling at all levels. And this is a confidential and it is a totally anonymous. Next slide, please. So coming to the egg donation program. So what is this? In this procedure, the fertile woman donates an egg to other women to help her fall pregnant. So the first pregnancy with donated oocyte was way back in 1984. And nowadays, the oocyte donation program constitutes at least like 10% of all ART cycles in US. And in India, it constitutes about 20% of all the ART cycles. Next slide, please. So when is it useful? So it is useful for women who are of elderly age group, who has got reduced quantity as well as quality of eggs, and in women who have got reproductive problems like ovarian failure, And in problems in women like who have got ovarian failure because of treatment like chemotherapy and radiotherapy also, oocyte donation program can be helpful. And in women who have got poor response to IVF treatment, this is helpful. And in women with genetic diseases, this is helpful. And nowadays we got like pre-implantation genetic diagnosis to help women with genetic diseases. And in women with advanced maternal age or recurrent implantation failures, or sometimes when there is a combination of all these factors also, then we can have this, we can use this. Next slide, please. So, what is the risk of permanent childlessness and female age at the time of starting to try to conceive? So, if the woman is age 30, her chances of permanent childlessness is 6%. And if she is at the age of 35, her chances of permanent childlessness is 14%. And if she is like at the age of 40, then her chance of permanent childlessness is 35%. And what happens by postponing the first conception attempt from the age of 25 to 30 years? It means the number of children born decreases from 2 to 1.7, and increases the infertility prevalence from 9.8 to 15.8%, and increases incomplete families from 14.8 to 24%. So next slide, please. So, age is a very, very important factor in fertility, especially the female age. So, all the women are born with set number of eggs, approximately 1 to 2 million eggs at the time of birth. So, over the time, the number of eggs go down, and the fertility rates also decreases as the woman increase in age. So, the main decrease in fertility starts from the age of 32. Sorry, I'm just okay. The fertility decreases after the age of 32, and once the woman crosses the age of 37, there is a dramatic fall in her fertility. So, women should be counseled and warned regarding the decrease in fertility with the age. And once the woman reaches the age of 51, majority of the women reach their menopause. Next slide, please. So let us look into the live birth data in an IVF cycle. This is got from the HFEA, that is a Human Fertility Embryology Authority data. If you take a woman aged 40, her chances of live birth rate is 12.1%. At the age of 41, it comes down to 10.3. And after the age of 42, it comes down to the single digits. So at the age of 45, if the woman undergoes IVF, her chance of live birth rate is only 1.6%. Can you imagine in what other branch of medicine would you let patients insist that we perform an elective operation with 5% chance of it working? Next slide, please. So, who should be a donor? Ideally, the woman should be younger, she should be healthy, and she should be fertile as well. And she should have normal ovarian reserve. This usually we test by doing a laboratory testing, mainly the AMH, and by doing a transvaginal ultrasound scan, we come to know about the ovarian reserve or the fertility capacity of the donor. And she should be subjected to tests like communicable diseases, and genetic testing should be done, and genetic screening should be done. And if there are some diseases that may be prevalent in the ethnic or the racial background of the mother, before the donor, they should be given a clean sheet before the egg retrieval. And then the physical testing should be done, and the donor should undergo a thorough psychological evaluation is a must. She should know what the procedure she's going to undertake and what are the complications of it. What does the treatment involve? What does the treatment involve? What are the complications from it, and what are the future implications for her? Should be thoroughly counseled. Next slide, please. And then she should be like, we have to take a detailed history about her background, and like medical, family, and personal history should be taken into account. And she should have a separate appointment with the psychologist as well as a genetic counselor And we have to do a thorough physical examination before the woman undergoes donor donation program. And then we have to do tests to make sure that she's healthy. Next slide, please. So, what happens in the donation program? So, once we select the perfect donor for us, then the woman, like on the day 2 or day 3 of the cycle, she undergoes a transvaginal scan, check the ovaries, and the hormone tests are being done, and she takes the hormone injections for approximately 9 to 11 days. And once the eggs are ready, she undergoes oocyte pickup under anesthesia. And that day we will know the number of eggs, the quality of eggs as well. And what should we tell the woman after the procedure? And during the procedure also, the woman should abstain from intercourse, because there is a risk of her falling pregnant, and this can lead to multiple pregnancy as well. And we also should warn her the ovaries become enlarged because of the treatment, and she should refrain from high impact activities like running, manual labor, mountain biking, and jumping until several weeks after the egg retrieval process. And it takes nearly approximately a month for the ovaries to return to the normal size. Next slide, please. So, if the donor asks us, will it impact my fertility or will it deplete my eggs? The answer is no, because the procedure itself does not have an impact on her future ability to have children. As I have mentioned, that women are born with 1 to 2 million number of eggs. And each month, out of these million eggs, a group of eggs begin the maturation process, but the body selects only one egg and that ovulates, while the rest of them becomes atretic and the body absorbs them. So what does the fertility medications do? It rescues some of these excess eggs that the body would have normally discarded and help in the growth of them. Next slide, please. So what instructions and what responsibilities should the ovum donor have? So first of all, she should be truthful in all the screening process, and she should follow the advice that is given to her during the treatment cycle, and she should take the medication strictly and maintain her appointment schedule, and she should abstain from sex from the start of hormone medications until 3 weeks to a month after the egg retrieval process, and it prevents unwanted pregnancy and makes sure that the cycle proceeds as planned. Next slide, please. So coming to the next part, that is a sperm donation. So it is the provision of a man of his sperm, and with the intention that it is going to be used in the fertility treatment to a woman who is not his sexual partner. And the man is named the sperm donor, and the sperm he provides is called the donor sperm. And the main thing is the man will not have any legal rights to the child who is born through his sperm, and he'll not be the legal father too. Next slide, please. So, who is it for? So, it is offered to couples when there is no possibility of getting sperms, either in a natural way or by a surgical means, or if there are any genetic diseases, or in females who don't have a male partner, we can use and go for a donor semen. Next slide, please. So, and the sperm that is obtained is stored in the sperm bank. Basically, it is a cryo bank or a facility where we store the sperm for use later on. Okay. So, and what these samples must be should be preserved for at least 6 months, and it is totally confidential. And consent forms are taken from the donor, and before we start treatment, from the recipient too. Next slide, please. So what are the requirements for sperm donor? The sperm donor should be healthy. They should undergo tests to see if there is no transmissible diseases, and the HIV, hepatitis B, hepatitis C, VDRL should be done. Blood group should be tested, and genetic tests like for thalassemia and sickle cell disease should be done. And the medical diseases should not be there, like the common diseases like diabetes and hypertension should be screened, and they should have a healthy family and a medical background. And this following information will be taken from the donor, that is the height, weight, what is their qualification, what do they do, and what is the color of the skin, what is the color of their eyes, what is the color of the hair. So we can do the matching process so that we can select a donor as near as the couple, so that the identity will be similar to the parents. Next slide, please. So, in what all ways can we use a donor sperm? So, donor sperm can be used in an IUI for an intrauterine insemination procedure, or it can be used for an IVF or for an ICSI procedure. So, it depends upon various factors that we take into consideration. Then we can use this accordingly. Next slide, please. So, regarding sperm donation, I'll just cover like some of the details that are commonly asked questions for sperm donation. So, the commonly used thing that we hear in our day-to-day practice is, ma'am, can we use the semen of my relative or my friend? No, it is we cannot use it, and it is illegal in India. So, it is like always the sperm or an egg is from an anonymous donor only. Can we use, next question is, can we use fresh semen? No, it is not safe to use the fresh semen, as the donor may be in the window period. So once the donor gives a sperm semen sample, he undergoes tests. And suppose if he is in the window period, and if we immediately, without storing it for 6 months, if we release the sperm sample, there is an infection risk. So it's always better to use a quarantine sample, is safer. Next slide, please. And how safe is it? So if you get the sperm, it's always ideal to get from the accredited banks only, because in the accredited banks, all as per the guidelines, all the tests are done, the screening procedure is done, the selection criteria is done. So it is very safe, and it is always better to get the sperm from the accredited bank. And coming to the next question, will the child be very different in appearance from the father? So, because we get the details from the donor, so we can match it to the father, so that the difference is less likely for the child to be different. Next slide, please. So, is cryopreserved frozen sample safe and effective? Yes. Now we have got like good cryopreservation methods. It can be frozen for years in a good environment, and we got like reasonably good efficacy with the stored frozen sample. And coming to this is also one of the commonly asked questions in our day-to-day practice. Can we select sample with specific blood groups that we want? Yes, we can request the same, and definitely that will be considered. Next slide, please. And can a single woman opt for sperm donation? Yes, it is legal for single women to conceive through sperm donation process. But again, as I told you, like in the donation process, always thorough counseling is important. Woman, what it would involve after she falls pregnant and everything. Next slide, please. So coming to the embryo donation, this is a very successful form of treatment. Today, when I was looking at the BBC News, I was very happy to see that one couple gave birth to a baby girl after the embryo was stored for 27 years. So, and they didn't have any problem. So, it is very nice to know. So, because one, it knows, the one is like it is a very successful form of treatment, and it can be stored in an ideal environment for many years without any impact like that. So here in embryo donation, what happens is the embryos that are stored or the egg and the sperm are bought from the donors, and this can be transferred to infertile patients in order to achieve a pregnancy. Next slide, please. And what are the indications for embryo donation? Suppose if both the partners, there is like untreatable infertility problems, they can undergo embryo donation. And in a single woman, there is like untreatable infertility, she can go for embryo donation. And sometimes, like when the recurrent pregnancy loss is because of embryonic factors, embryo donation is a good option in this set of people. And when there is like genetic disorders affecting one or both the partners, then we can go for embryo donation. So which is better? So, and whether embryo donation is better, adoption is better. So usually what happens is, what are the advantages of embryo donation over adoption? Here the woman carries pregnancy in her uterus, and she enjoys the throughout the pregnancy, and she delivers the child. She can breastfeed the child, and there is like better bonding even though there is no genetic linkage in embryo donation process. Next slide, please. So once we have a good embryo, then the recipient should be screened for all the genetic disorders, for all the medical problems, and we should see like how her uterus is. So after proper screening, what we do is like we can match the donor as well as the recipient. So in majority of the patients, we can match the donor and the recipient. In some, when we cannot match it, then we'll cryopreserve the embryos for later use. Then after screening and matching, then what happens is the recipient receives the medication so that the endometrial lining, that is the uterine lining, is good. So ideally on the day of the donor pickup, the endometrial lining of the recipient should be ready. Then we can plan for an embryo transfer. Next slide, please. So as I told you, like in a fresh cycle embryo, the donors are screened. They undergo after like thorough screening, thorough counseling, and then the woman undergoes the stimulation by taking gonadotropins. Then once the exercise is good, she undergoes egg pickup. Then we take the donor sperm from the sperm bank, and we we do the IVF process. Then we grow the embryos until the blastocyst stage. And in the meantime, the recipient's uterus is prepared. And once the endometrium is ready, usually the recipient can take up to 10 to 12 days of medications for them to do the embryo before the embryo transfer. And once the endometrium is ready, the properly screened embryos is inserted with a fine tube under ultrasound guidance into the uterine cavity. Next slide, please. So, what are the advantages of embryo donation? Here, it is very simple because the woman is not undergoing, the recipient is not undergoing the ovarian stimulation. So, she's not taking, so it is less amount of medications, and she's not undergoing the procedure as well. So, there is no risk of anesthesia or the procedure to the recipient. And this is very cost-effective treatment, and the cost of embryo donation is lower than a conventional IVF cycle, and we use less amount of medications when we are going for an embryo donor. And at Nova IVF, we got like very good success rates with this procedure. When we took the success rates from January to March 2020, in a oocyte donation or embryo donation, in a fresh embryo transfer cycle, the success rate was 77%, whereas in a frozen thawed cycle, it was 68%. So usually we choose donors like who had like successful pregnancies before. So the chances of the success is better with this embryo donation program. And donors, as I told you, in our unit go through extensive evaluation before choosing them as donors. Next slide, please. Thank you. If you have any questions, we can answer them.
Thank you, ma'am, for the session. I have a few questions, ma'am. I'll read out, ma'am.
Yeah.
One of the participants has asked a generic question, ma'am.
Yes.
So the question is, my age is 30 and my hubby age is 32. His reports are very good, but in my reports, tube blockage issue. So what should I do?
See, first of all, it is ideal for you to come to us and we have a thorough examination and evaluation. So at the age of 30, if everything else is fine, if the ovarian reserve is fine, if the semen analysis is fine, and if the tubes are blocked, we have to check like whether the tubes are blocked in an HSG or in laparoscopy. In HSC, sometimes we get like, even though sometimes we get a false positive report. So if that is the case, then we have to double check whether the tubes are blocked by laparoscopy or not. And if it is genuinely, if the tubes are blocked, and if your reserve is good, and if the semen analysis is good, then we can go for an IVF cycle for your using your own eggs and with your own sperm, provided after our investigations, both the egg reserve and the sperm is normal.
Thank you, ma'am. Ma'am, one more participant patient has asked a question, ma'am. Ma'am, I have 7.7C fibroid, married 7 years old. I haven't conceived. Husband for motility is very low. Ma'am, suggest me, should I go for IVF? This is a question, ma'am.
So what is the age of the patient? Sorry.
Age they have not mentioned, ma'am.
It is like 7 centimeter fibroid, is it?
Yes, ma'am. Yes, ma'am.
Okay. See, yeah, as I told you, like again, we need like evaluation in the center. 7 centimeter fibroid, mostly it will require removal. That we can try to do it by laparoscopy means. And then, as I told you, like we have to take many things into consideration. It is not like one report that we base our thing. Yes, 7 centimeter fibroid, mostly we have to remove it. We'll be taking your age into consideration. About the other aspects, like what is your ovarian reserve, like we'll be checking that with the help of a transvaginal scan. We'll look into what the ovarian reserve, like looking into your antral follicle count, what it is, and what is the level of AMH. This will give us an idea about the ovarian reserve, and it will also tell us like where the fibroid is situated, how is it distorting the cavity or anything, we'll get to know. And the semen analysis will check like how low is the motility, how are other parameters like morphology, the sperm concentration, before taking a decision on that. And obviously, if the motility is very low or if the counts are very low, then yes, ICSI can be done. But first, let us do a thorough evaluation before we embark on any treatment.
Thank you, ma'am. There's another question, ma'am, from the patient. So they are asking, what would be the success rate if I go with the donor program? Will there be any guarantee?
Okay. See, comparatively, the success rates in our donor program is very good. But there is, as I told you, it is not like 100%. I have been trained in UK, and throughout the world, it is not 100%. The reason is, it is not only the donor egg or the donor sperm, it is important. There are various other factors that are important for the successful pregnancy. Suppose if you're taking donor egg, we have to know like how the donor sperm is and how the embryo that forms is, and what is the receptivity of the endometrium, and is the endometrium and the uterus good, and what is the age of the patient. See, as I mentioned in my slide, the live birth rate, if you are going for a 45-year-old, it is like less than 5%. So there is like various things that we take into consideration, but comparatively, the donor program has got very good success rates in our center.
Thank you, ma'am. Ma'am, let's wait for 5 more minutes, ma'am, to get participants. If you have any questions, do ask us on our Facebook comment session.
Sorry, Kiran, say that again.
Ma'am, I was asking questions, if any questions from the participant. Okay. Ma'am, we have a question.
Yeah.
Ma'am, good afternoon. My age is 36. My AMH is less than 2. Will I be advised for a donor program, or can I go for a self cycle?
See, the age is 36. After the age of 32, as I told you, the fertility slowly comes down. And after the age of 37, 38, there is a dramatic fall. So again, we have to individualize the treatment here. So if your age is 36, then I'll be looking into what the AMH is. It is less than 2. But what is the exact value? If it is 1.8, 1.5, yes, we can try with your own eggs. If it is like 0.001, then yes, the donor eggs will be a better option. but I will take like I know that AMH is less than 2, but you also will need a transvaginal scan to assess the ovarian reserve. Yeah, so suppose if the aim, if on evaluation, if the AMH is only like 1.5, 1.8, and if you have got like a reserve, see, some we have got like seen normal pregnancies as well in the age group of 36, 37, 38 as well. So it depends upon what your ovarian reserve, even in the scan is, and if it is less than 2, whether it is like how low it is. Suppose if the value is very less, like 0.01, 0.5, then more likely you would need a donor egg. But suppose if you have been just trying for an year and if the reserve is just slightly low, then yes, we can try for self eggs as well. But the success rate compared to a 30-year-old or a 25-year-old will be slightly lesser because you're like 36-year-old. But we have seen successful pregnancies even in women with like 37, 38 as well.
Sorry, ma'am. We got another question. My age is 38 and my wife age is 28. My sperm count is very low. One IVF cycle failed with my own egg and sperm. So what we do? What should we do?
So the age of the wife is fine. We got a one failed IVF cycle. So we have to see what the count was, like what exact count was, like how low is low. So according to the WHO criteria, if it is less than 15 million, it is low. So if it is like again, if it is only few sperm and if the quality of the sperm was not good, so I'll go into the details of the first IVF cycle, how the sperm was and how many embryos we formed, what was the quality of the embryos. Suppose if the quality of the sperm was very bad, then we can do like tests like DNA fragmentation index, and we can do tests like MAX, that is magnetic associated cell sorting, and choose the best sperm and try with your own sperm. But if it is very low or if the quality of the sperm is too bad, yes, then we can consider donor sperm as well.
Thank you, ma'am. So we got a question, ma'am, a general question. What information can a recipient get to know about donor egg and what investigation they do for donor?
See, usually it is an anonymous process. So what the recipient will know is like the physical characteristics of the donor, like well, what is the color of her skin, what is the color of the hair, what is the color of the eyes, the educational qualification, the age, all that they can know. The physical characteristics they can know, but they will not know who that person is because that is totally anonymous. So that much details like whether they are educated, what profession they are doing, all that we should be able will be able to give. But the things like who the donor is, it is totally anonymous. That will not be given. And what investigations? As I told you, like will they do for the donor? The donor first main thing is like the proper detailed history taking is very important. Then they undergo tests like an examination like with us, and then we also do a transvaginal scan to see if everything is normal, and they also undergo like the basic test like the complete blood picture to make sure that the hemoglobin is fine and there is no diseases like thalassemia, sickle cell anemias in the family in her. And then they also undergo like fasting blood glucose, blood urea, serum creatinine, all the routine tests are done, and the thalassemia profile is completely done. Then after that, if there is any genetic testing or if there is any diabetes or hypertension, they are not taken and they are not considered for a donor program. And they are screened for tests for HIV, hepatitis B, hepatitis C, VDRL, and the blood group is checked so that in couples who want their blood group to be matched, we can match them as well. Thank you.
Thank you, ma'am. Ma'am, there are no more questions, ma'am. So before ending, thank you, doctor. Dear attendees, thank you for attending the session. That was Dr. Saroja Koppala, who has taken us through donor program in IVF. So let me remind you about tomorrow's session, which will be about advances in IVF, newer technologies in ART by Dr. Himadipti. So kindly attend, log into the session at 3:30 p.m. Any questions regarding the session of today's? So doctors will be answering you back. You can mail us at allaboutfertility@novaivffertility.com. Namaste. Thank you, ma'am. Thanks a lot for the session.
Thank you very much. And if you have any doubts or any queries, always you're welcome to visit our center, and we are there to help you to achieve your dreams. Thank you.